My name's Jim Frame. I'm your medical director and have been so for the past 3 or 4 years now. Time flies. In any event, what I'm going to do tonight is something a little bit off the beaten path. After sitting for an EMT registry exam myself just recently, and of course participating in examinations and such for EMS, the National Registry, what we've come up with is tips and strategies for taking the exam. Now, to be honest with you, this is not going to be long because the National Registry exam has become so straightforward now that there really isn't much going on with it except just straight didactics. In other words, they give you a scenario, you figure out what the scenario is, you give the best answer. It's all multiple choice, it's all best answer, and it all comes from the big 6 areas that you'll be responsible for. It seems like medical and cardiology at the paramedic level are the 2 biggest areas. They account for about 40% by themselves, and then the other 3 sections, 20% apiece. So it's not that it's going to be hard. The National Registry decided 10 or 12 years ago that there's not going to be any quick trick questions, no curveballs, nothing like that. So they just want it straightforward. And everything that you need to answer the question is in the question. So what you want to avoid doing is trying to figure out, is the National Registry tricking me? Am I supposed to presume this and therefore I can go in this direction with this answer and such? So what we're first going to talk about is why the National Registry went to computerized adaptive testing. Those are the big 5 areas right there again that we're talking about. They went to adaptive testing because the computer is the one that makes the judgment now. The computer is the one that has a bank of questions for question number 1. And let's say that that's for airway. It gives you a question which everybody has passed, pretty much an easy one. And so what you'll do is you'll answer that, and then they'll say, okay, fine, we're on a roll. Then they'll give you a question that 80% of the people that have taken the exam have passed. And then it goes down to 70, 60, 50. And once you get past those questions and the computer is satisfied that you know your stuff, that it wasn't a guess and it wasn't a fluke, then it moves on to the next bank of questions. On your computer screen, you see question 1. On the computer screen, then you see question 2. And if they look similar, if they look related, if they look like they're an airway, then the computer is testing you, and they're testing you a little bit harder and a little bit harder, which is why it's very difficult, almost impossible to get a perfect score on these exams, because the computer will keep giving harder and harder questions until finally it's satisfied that you know the area and that you've mastered it, or that you've gotten one wrong, and then it moves to the next one. But it gives you full for all these questions as you go along. Now, you may say, if I pass every single section, do I win? Do I get 100%? And the answer is no, because for each question that you have missed, then it drops back 1 to a little bit simpler question and has you answer it again, but you still got the one wrong. So computerized adaptive testing means same thing as if any of you have watched any of my scenarios before. I'll ask questions until I can finally figure out where the edge of your knowledge is at. And then once I figure that out, I'll backtrack a little bit, we'll talk about other things, and then I'm very comfortable in knowing that you know what you're talking about. If you miss 1 or 2 little items here and there, just like the computer, I'll just drop back a little bit to a little bit less difficult question, talk about it some more, and then we move on. So these are the 5 big areas. I think I said 6 earlier, but it's actually 5. These are the 5 areas. Remember, for paramedics, medical and cardiology constitute the biggest chunk of the exam. Now, we just went through all that. The computer says, okay, I've got 100 for the, yeah, okay. I got to keep playing with this. Now, when the computer, just like everything else in life, there's a confidence level. And in research, if your test and your statistics and everything show during your research that this result can hit the confidence level 95%, then that's a pretty good standard to hit. Uh, you'll find most EMT and paramedic exams, critical care exams, nursing boards, such like that, they hit the 90 percentile. Computer is confident 95 out of 100 times that you have mastered this area, and so it moves on. It doesn't mean that you get 95 questions. It doesn't mean that you score 95% based on 5. It integrates a lot of statistical data. Each question that you get on the exam is assigned a difficulty score, and that score is then multiplied by another factor, and that's all thrown in a big statistical formula that will probably fill this room. And then the computer, which of course is doing a couple of billion calculations a second, will be able to figure out within a heartbeat if you're competent in that area. So for the paramedic exam, there's a bank of 150 questions that you're going to be asked to answer. For the first exam, for your initial exam, it's a 70% pass. So you do the simple math, 70% of 150 questions, you need 105 right. But computer goes along and says, you know what? I've already asked this guy 85 questions, and I'm 95% certain this guy has mastered the material. And so it may cut you off right there and say, game over. It's good. And I've not seen the computer be wrong in any of it. People that they've passed are good. People that they failed. If you get to the point where the computer feels that you have not mastered anything after 85, 90 questions, then at the 95% level, then the computer may cut you off and say, nah, there's no way that this guy or this girl knows within a 95% certainty that you're competent or you've mastered the subject material. Now, I qualify that by saying mastering subject material. There's plenty of you guys that are out there, guys and gals, that are street smart. You'll probably go through 1 or 2 or maybe 3 National Registry exams before you're allowed to practice on the street. But once you get on the street, of course, you're a hands-on, real good dude or dudette, and you know that stuff back and forth out there, and you can do it. That's a streetwise paramedic. Unfortunately, it's not the world that we live in. We just don't have the time or the resources as a country to sit there and evaluate every single paramedic that's out there for 25 or 30 runs and decide, yeah, this person's street smart. So we have to go to these types of testing. I can tell you this type of testing is a whole lot more fair than the testing of the eons before us in the American educational system, where you were given multiple choice, yes or no, hit this bar, and you passed or you failed. The fact that the computer says, okay, that was a hard question. Let's drop back one. Do you know this question? Yeah, I know that question. Do you know this question? Yes, I know that one. And do you know this question? Yeah, I know that one. Okay. Feel pretty comfortable that you know this stuff. You got one wrong, big deal. We move to the next bank of questions. So I think you'll find it to be quite interesting. As you sit and take your exam, just like you did for EMT exam, when you take your exam, you're going to find some of the questions get a little bit on the impossible side, like what are you asking that for kind of thing. And the answer is because it's kicked its rear end all the way going up to it. Now it's reaching into the deep recesses of its hard drive to figure out some hard question that you can't answer. You should take great comfort and humor in that, knowing that, hey, I got a lot of hard questions. You did? That means you passed. Or you bombed it, but you probably passed it. So don't be surprised. There's some people that have gotten through these exams that have answered 73 questions and they passed. Some people have gotten 85 and they failed. One person got to 124 questions and they passed. It's not until it's over. When the computer says you're done and you feel like you did real well, you passed. And if you didn't do so hot and cut you off early, then we've got some things to talk about. So, all right. So here's the way they set it up. The first 10 questions on the paramedic exam are the ones that score the highest points. It tells the computer, okay, These are the ones that he's gotten right, she's gotten right. These are the ones that he or she have gotten wrong. So for each one of these top 10 questions and the subject matter that they're related to, I'm going to pick a harder question or an easier question. The first 10 questions really sets the stage for the computer and says, okay, this guy's aced the first 10 questions. This is great. We're going to give him these competency levels here. You're going to find that those questions get just a tad harder. That's okay. Point value that's assigned to each one of those questions may be higher than questions on the test. This isn't about one right, one wrong. I have to hit 70% and I pass. You have to convince the computer with the 95% confidence level that the computer feels comfortable with. You know the material. Knocking out the first 10, that's a great start. You may be 15 or 16 points into it already, even though you've only answered 10 questions. Some of those questions, like I said, are double jeopardy. They go for big numbers. And so it behooves you to have a good start. And we're going to go into time management here in a little bit. All right, and here we are at time management, especially for the first 10 questions. When you light up the exam, it says, okay, you ready to start? Yes, I am. Here's question number 1. Those first 10 questions, I would spend about a minute to 2 minutes on each of those questions, the first 10. After that, you can go to 1 minute. This is 150 minutes that's allowed for 150 questions. And there's a good chance that none of you are going to reach 150 because you'll have already convinced the computer that you know what you're doing. So 1 minute a question is not a big deal. And yet for the first 10 questions, I want you to be absolutely sure. I don't want you reading into it. I just want you to be absolutely sure that you're reading the question, okay? And then reading the answers. And we'll go into that strategy here in a little bit. Again, as you take the exam, you get the first 10 questions, all of a sudden you're like, man, where did this question come from? This one got hard. Laugh at it quietly so that the purview person doesn't think that you're having fun with the exam. What you want to do is take great solace and comfort in the fact that it thinks well enough of you to give you a more difficult question. If you don't get that question right, you take a good hypothesis at it, we'll go over some of those strategies here in a minute, and it comes up wrong, you're going to see a similar type of question following that, but it's going to be a little bit easier. In theory, you should never get 2 questions wrong in a row because you've answered one correctly, so it gives you something a little harder. It asks you something a little harder, you got it right. Then it asks you something a little harder, oops, you got it wrong. Backtracks to the same level of difficulty question that you had when you got it right, and I'll ask you that question in a different way or a different question, same difficulty level, and you'll get it right, boom, it moves on. And then it plugs into a statistical formula. And remember, those first 10 questions are important. Now, multiple choice test taking tips is something, this has been around for a long time. In medical school, and then for the board exams, we have 3 types of questions. The first third of the exam is the best choice, multiple choice, just like what you're getting. And second exam portion is all matching. So you get 27 things over here, you get 10 questions over here. Which one of these 27 things belong in these 10 columns? And then the third one is what they call a K-type question, where they give you 4 choices and they say, okay, is it 1 and 3? Is it 2 and 4? Is it 4 only? Is it 1, 2, and 3? Or is it all of the above? And so those are pretty big ass kickers. But you know, when it comes to adaptive testing, such at the medical school and physician level, we're at the confidence level 99%. So sometimes we can go 6, 7, 8 hours and convince the computer that we are comfortable with 99% of all of this stuff. The computer adaptive testing has revolutionized the way that we test, but none of this revolutionary stuff is going to be to your benefit if you don't do the fundamental characteristic examination of the question. That is, I read the question and then I read the answers. Some of you may say, well, I want to read the answers first and then see if the question fits it. Big buzzer, wrong. Questions sometimes will give you the answers right in it. Other times they're scenarios. And other times they're going to give you perhaps a string of facts. And then you're going to be asked to choose from 4 detractors, what they call the multiple choice piece, the A, B, C, or D. Here's the kicker with it. All 4 of those answers could be correct if you just read them out loud all by themselves. The 2 bones in the forearm are the radius and ulna. The 2 bones in the lower leg are the tibia and fibula. There's 33 bones in the skull. There's 36 teeth in the mouth, blah, blah, blah. Yeah, okay, all of these are right. So why are they asking me for which one is right? And the answer is, you go back to the question, you ask, what are they really looking for here? Is it a simple, gee, what are the 2 bones in the forearm? That's one thing. The second thing is going to be a scenario where they're going to give you a 28-year-old person who's involved in a motorcycle accident. You arrive on the scene and he's got a 60/40 blood pressure, 130 pulse rate, respiratory rate is 6. You notice that he's got a large area of ecchymosis over the left lower chest and the left upper abdomen. What solid organ is most likely injured, accounting for the hypotension? Again, it's going to cause you to do 2 things here, and that's an actual question, by the way. It's going to give you two things that you're going to have to decide. Number one is it's asking for a solid organ. So now you have to refresh yourself on the anatomy. Let's say I got a lung. Is that a solid organ? Yeah, kind of, sort of, but not really. Is the diaphragm an organ? No, it's a muscle. Is the chest wall an organ? I suppose. Is the spleen on the left side? Yes. But it'll list the liver as well. Or it'll list the small bowel. It'll list something there. There's going to be one fairly obvious choice here and one that's kind of close. So don't let them really blindside you on one or the other. Eliminate the answers that you know that are completely wrong. And once you eliminate one answer, then you're down to the last 3. Try a second one. Some of these anatomical questions that has to do with scenarios and such like that should not be difficult for each of you paramedic students. Anatomy should be secondhand to you now. Again, there's no curveballs here. They're not going to ask you, geez, where's the splenic artery coiled and around what structure does it coil? It's not going to ask you stuff like that. It's going to ask you about solid organ and is it responsible for this particular injury? It's A plus C equals C. Okay, A plus B equals C. Read all the choices before you answer. Make sure you know why each detractor is wrong before you mark the correct answer. Okay, some of you sometimes will change answers. Now, here's the cool thing about computerized adaptive testing. One chance, that's it. There's no back button. You don't get to go back and answer the question. You don't get to go back and look 2 or 3 questions back. And here's the worst part. You don't get to skip a question and do 5 or 6 more questions and then come back, excuse me, and figure out what that question was. This is progressive testing. Computer gives you no second chances. It'll ask you harder questions, which is the computer's way of saying, here's your second chance, here's your third chance, here's your fourth. And it stops at the 5th chance and then decides whether or not you know that particular material for that particular question. So don't change your answers in your head. If your gut feeling tells you that it's A, B, or C, or D, then go with it, but be able to say why in your head it feels that way. Now, some of you have already got some street smarts, and some of you have got some legitimate street medical experience. So when you read a question like this, and you're going to take your time reading it, find out what are they asking, and then you're going to make the right choice. In an all of the above or none of the above choices, if you're certain one of the statements true, don't pick none of the above. This was horrible because on the adaptive testing, if you get that question wrong, they give you another one, then another one, another one, just like we talked about. Subsequently, if you choose none of the above and it gives you an next question, it's already going to kind of put in your back of your head that, hey, one of these statements really was correct, and you knew that because you answered the next two questions correctly. If you're convinced that one of those questions is right, please don't choose none of the above because none of the other ones are right. Maybe that's just the answer and it's just a single answer. Don't be thrown off by none of the above or all of the above questions. Okay. Conversely, if you know that two of the four questions are correct, or the answers are correct, then choose all of the above. Don't choose the best one of all that if an all of the above is present. If two of them are right, you can roll with it. All of them are right. Okay, these are giveaway kind of questions. And so take a second. We just talked about the strategy and how we're going to take our time, a minute or more a question, especially for the first 10. We're also going to talk about all of the above and none of the above and how you're going to eliminate answers. And if two of them are correct, choose all of the above. If one of them is correct, please don't choose none of the above. And you're going to get into a process elimination with the best answer choices when you're faced with just four regular answers, A, B, C, D. You're going to get into eliminating the really outside the box ones. Now, I'll tell you how to approach it. In that you don't know the question, you don't know the answer, you don't know your date of birth, you don't know your name, you don't know nothing. You're looking at it and you think you're reading, something out of Norway or Finland. I mean, I don't know the question, I don't know the answers, I don't know nothing. We'll get into those kind of strategies here in a little bit. But let's talk about some of the giveaways. Now, keep in mind with the giveaways, if you know the answer, and it's no matter where it's at on the exam, if you know the answer, go ahead and mark it. This is for folks who look at a bunch of answers that don't quite know what the answer is. They can eliminate maybe one answer, but they still got three to choose from. So in the types of questions that you're not sure of that have number answers, for instance, an adult respiratory rate, pediatric respiratory rate, and adolescent respiratory rate, newborn respiratory rate. From newborn to toddler to adolescent to adult. Those four questions show up in some form on every national registry exam without fail. Shows up on the EMT exams, shows up on the paramedic exams. You may just want to memorize those if you don't have a good feel for it. I would memorize those four, and you're going to get at least two of those questions. Okay, so when faced with that, what's the normal adult rate for respirations, if you will? Well, we know it's 12 to 20. But if you're not sure, if there's a 8, 10, 12, 15 kind of answers to whatever question it's out there, and you're not sure what the answer is, then look at the two middle numbers. There's a good chance it's going to be in the middle. So throw out the high, throw out the low, and then make your best hypothesis, best answer based on the middle values. That's a tip. Again, if you don't know the answer outright, try the elimination of the higher and the lower numbers. Now, we have a different type of question called lookalike options. Now, the National Registry has done a great job in making sure that these are eliminated, but every once in a while one gets by. And so what I want you to do is look at the answers themselves, and you'll say, well, geez, this one says pick whatever example that you want, but it'll come up with a statement such that the patient has a stab wound to the middle of the abdomen. Which of these organs are likely not affected? And so they're going to put down large bowel, pancreas, stomach, spleen, liver. They may put a combination, liver and spleen, liver and pancreas, liver and stomach, stomach and pancreas, pancreas and spleen, whatever that looks like. You're going to see that there's going to be some lookalikes in there. There's going to be some overlap. It's going to go, well, you know, this could go either way. And so when you look at lookalikes, you want to take the two answers that look really the same, that are almost saying the same thing, and note that they basically cancel each other out because both of those are usually incorrect. So like the liver, spleen, okay, the liver, tail, the pancreas, the liver, the heart, you know, yes, it's possible. Is it likely? No. So when you see lookalikes, when you see two questions that are two answers that look like they're the same, they both have canceled each other out. Don't worry about those from the other two. Now, conversely, you're going to get an echo. So if two options are really opposite of each other, one says red, the other one says blue, there's going to be a very high confidence level, very high, that one of those answers is going to be correct. The lookalikes, both are incorrect, but the echoes, where they're opposite, or you can call them opposites, not lookalikes, but opposite options, one of them is incorrect. The other one is going to be correct. And so I would eliminate the other two options right away. Now I have to preface this again. Unless you know the answer outright to the question, and you're not sure what they're asking, and you have to go through the process of elimination, watch for the lookalikes, the number range, and the opposite or the echoes. Identify that as a type of question, then use the strategy we just talked about to eliminate answers. And maybe one of them will just pop up in your head, and you'll get the correct answer on it. Another way that you can approach some of these questions is to say in your head, okay, I got to eliminate these things. So is this statement true? So you read letter answer A, ... Okay, that looks pretty good. I'll mark it as true. What about B? C is false, D is false. So really I'm left with A and B. That's another way that you could go about doing it. But that's just a variation on a theme. However you decide that you're going to eliminate the really outside the box answers is really your individual strategy. But I want you to develop a strategy. You're going to have some sort of focus in your head that says, geez, okay, I'm faced with this kind of question. Back to Dr. Frank's lecture. Yeah, these two answers look about the same. This one's not so much. I'm going to go with this one. Okay. Or, hey, these two answers are opposite each other. It's got to be one of these two. All right, because the other two are really weird. So you'll go with those options. Again, that's if you don't know the answer outright. Now, sometimes you'll read a question and you'll say, you know, New York and Chicago are in the Northern Hemisphere, at, you know, above the Tropic of Cancer kind of thing. Which of the following is below the Tropic of Cancer? You know, whatever EMS question that you're going to run into that gives you a statement, and then the answer is actually a continuation of that sentence, but for, or however, or the following cities belong in the Northern Hemisphere: Boston, Chicago, Miami. The following cities belong in the, and then you start reading each one of the answers. And if you were to take that answer and plug it in at the end of the question to make a one big long sentence, the questions that you can eliminate right away are the ones that have horrible grammar. They're awkward. You read through the question and it just doesn't look right. It doesn't feel right. As you take your practice exams before your paramedic test, you should know that there's a fair number of questions that actually grammatically do not fit. Sometimes that's to help you. Sometimes that's the questions that the National Registry puts in the exam to ensure that this question remains 100% answered by everybody. And then the next question is 80% answered, and the next question is maybe 40%, 50% answered by everybody. The more difficult questions. And again, if you're not sure of the answer, you look to see, okay, I'm going to plug this answer in at the end of the question sentence. Does it make sense? If it makes sense, you can at least consider it. But if it makes no sense at all, flips tenses, or just looks like it's just awkward, you can eliminate it. That's a very safe bet on the National Registry. Okay, when it comes to best answers, another strategy now is I look at the question and what is it asking me? It's asking me for some sort of scene safety. There's a whole segment on this exam called EMS operations. And I can tell you, if you know these four and you keep it straight in your head, you're going to know the answers to EMS operations. First and foremost, you arrive on the scene, you're working on a patient. Other ambulance coming. You take one patient who's on a backboard and cervical collar talking to you and such, all of a sudden your partner collapses. Another person from another ambulance comes up to say, hey, can I help you? What are your choices here? What do you do? And one of the answers is load the patient that you have, take the extra partner with you, and let the next ambulance take care of your partner. Wrong. You take care of your partner first. First and foremost, your partner is first. Okay, so the correct answer is leave that patient for the next ambulance, call the next ambulance, have them come in and take care of that patient. I'm taking care of my partner. That's the answer. When it comes to hazmat questions, they're going to ask you about hot zone, warm zone, and cold zone. The question that comes up all the time on the paramedic exams is, if you're in operations, what zone are you working in? Should be a piece of cake, warm zone. If you're in offensive operations and you're one of those hazmat technicians with more certifications than God, then they're going to work the hot zone. Somebody's got to work the hot zone. But defensive ops, in other words, your basic hazmat certificate, or if you're guys, any of you guys are TCFP or state certified firefighters in your respective states, you're going to know that a hazmat basic certification is defensive ops, and that gets you into the warm zone. That's a giveaway. The other one is going to be when you're pulling up to the scene and you can't identify a placard. You know, what do? Do you get closer? Do you use binoculars? Do you retreat? What do? Here's one of the questions that was in the registry recently. You find a man collapsed near a barrel of something. Nobody else is around and nobody witnessed it. As you're coming up, you see a little bit of a fog where you smell something that just doesn't smell right. What is the next appropriate step? Mask up, go in, get the guy, pull him out. Do you stand back and see if somebody knows anything that's on the barrel? These are all very good questions. And the answer to this is to step back. Why? Because as I capitalized on the slide here, your safety is first. Nobody's going to fault you for stepping back and taking a second look with binoculars or something to see what's going on there. You see 2, 3, or 4 people who are collapsed in the middle of nowhere, and there's no obvious reason for this. The correct answer is going to be, hey, let's wait and see what's going on here. If you see 2, 4 people, you pull up to a pool and there's 4 people unconscious floating in the water. Are you going to dive in and get them? No, because you missed the electrical wire that's in the pool now. You missed the short circuit that was on the big pool spotlight that created the electrocution, if you will. You've missed something here. Something should alert you to the fact that, hey, I got to wait. Your safety is first. It doesn't mean wait all day, okay? But it does mean take an extra moment and think, is this question asking me about scene safety? If it is, Your safety first, your partner's safety first, scene safety, BSI ABCs. Okay, those are giveaways. You got all those concepts down that I just went over with EMS operations just now. You'll get the entire EMS operations section correct. Wrong answer is real easy to find. I've got a metacarpal bones, phalanges, and a femur. Okay, which one of these does not belong to the hand? Kind of question. And so wrong answers are going to be real easy to pick up. So if you get a question like that, it should be pretty basic. But usually 2 of the 4 are pretty close to each other, and you have to find the best answer for the scenario that's in front of you. So the best thing to do if you don't know anything about the question, remember, strategies and tips is all about what happens when I'm not quite sure what they're asking. Strategies and tips tells you, get rid of the wrong answer first. Now, just like on medical school exams, emergency medicine board exams, firefighter exams, nursing exams, any exam that's out, never, only, and always, when they appear, it's not going to be the correct answer. There are no such thing as nevers, only, or always in the general context of things. If a question asks you, do you always watch out for yourself and always protect yourself and always ensure scene safety? Of course, absolutely, that's what you're going to do. But when it comes to always, nevers, and onlys, these are very restrictive questions. They do not allow for exceptions. They don't allow for anything. And you know that in the world of medicine, everything's an exception. There's only one forever, and that's death itself. Everybody else, though, never, only, and always. Those are very awkward words. And even on medical school tests, when we take those and we see never, only, we'll mark those as incorrect. We'll say to ourselves, now, if they're asking for something way too restrictive. And so you want to disregard answers like that. You always want complete answers. So look for the complete answer. Again, if you do not know the question outright and the answer, in other words, you're saying to yourself, okay, I got to think this one through. So we look for complete answers. You go through each of the choices and say, now, how am I going to eliminate these things? Well, this one looks pretty complete here, and it echoes a lot of the words of the question. Looks pretty complete. Okay, I'll consider that. If one looks awkward, incomplete, or only lists 1 or 2 requirements of the question, if you will, then there's a good chance that that one's not the one that you want to choose. You can eliminate that one. The National Registry, their exams, and these test-taking strategies are just for National Registry exams. They will put as much information down as possible, make sure the answer choice cannot be disputed at all. That's the way they've elected to make their exams, and this is what I'm sharing with you right now, is the fact that they've made a conscious effort to say, we don't want to make any trick questions. We don't want any red herrings. We don't want to give you a list of all these symptoms and then give you some one real awkward symptom over here where it's designed to throw you off track, or it's designed that you're supposed to disregard it. The National Registry has said, we're not doing that. And so they have created their exams to say that if we give you a complete explanation, then what you have to do is go back and look at the question and say, does that answer fit the question and what you're looking for in the question? So a more complete answer in the case of the National Registry tends to be the correct one. Tends to be, okay? This is not a never, only, or always. It's not always the right answer. Read it. And if you're not sure what the answer is, look for the one that gives you the most complete information applicable to the question. Qualifiers. In general, at the bottom of the slide, I'll reiterate, don't look for the always, never, onlys. Okay, they don't allow for exceptions, and therefore they're very, very unlikely to be the answer. You can cross those out. Now, don't be drawing on the computer screen. People in person view get real upset over that stuff. And when the next question pops up, you're gonna have to clean the screen. But in your mind, or on the scratch piece of paper, you're gonna have to say, no, I don't like that answer because it's got never, always, or only in it. I like this one. This one over here is usually, general, sometimes, often. They allow for exceptions. We're all going to get on the scene and we're going to see 10 heart attack patients. 9 of them are going to be pretty straightforward. But you're going to get that one person who's hypotensive or tachycardic or bradycardic. You're going to get that one anterior wall, which is supposed to have tachycardia, and it's going to be bradycardic. Why? Because it's really high on it and knocked off the nodal artery. So you had a patient with different circulation than other patients, maybe right coronary artery dominant instead of circumflex dominant. You know, you got this little genetic anomaly going on. So this is why never, always, and only doesn't work in the paramedic sense, because you just don't know what's going on. So yeah, for the one inferior wall that is tachycardic, you're going to go, oh, that's weird. For the one anterior wall MI that's bradycardic, oh boy, that's weird. But possible. Often, sometimes, usually, generally, anterior walls are tachycardic. Inferior walls are bradycardic. Inferior walls tend to drop blood pressures when you give nitroglycerin, whereas the anterior walls tend to need some fluids to help them keep their heart from racing too hard because of the tachycardia. Are these always, never, or only? No, they're not. They allow for variations. And so when you get an answer that allows for a variation, uses the word usually, generally, sometimes, or often, that is going to be at least a consideration for the correct answer. And at the same time, anybody who uses never, always, or it generally tends to be the wrong answer. This is the number one problem that we've identified on exams at the National Registry, EMS testing, things like that. The number one problem that we've identified is had the student take a little bit more time, 5 or 10 extra seconds. We're not talking years or months, talking an extra 5 or 10 seconds to read the question a second time. They would have then understood the question a lot better. They get so focused. I read the question, question number 22. Here we go. I read this. It's a 4-liner. It's a scenario. Okay, I got it in my head what the guy's doing. A, B, C, or D. 3 of these right, but they're right in their own context. Which one of these answers the question? I think this one answers the question. How about you do this? How about you go back and reread the question at that point and say, yeah, that the answer is trying to answer this scenario, so I'll choose this one. Don't be that guy. Don't be the one that memorized the question by one brief read through and then go to the answers and try and figure out which one is the best. Okay. If you're struggling between 2 or possibly 3 answers that, yeah, these all look correct, go back and reread the scenario and figure out, now, what are they asking? Which one of these answers fits what they're looking for? Most common mistake, you guys go through this too much. I had one student just recently come out, hey, it cut me off after 85 questions and I was done in 60 minutes. Oh, I got to tell you, my heart sank and I knew exactly what happened. And sure enough, the next day, he gets notified by the National Registry to, hey, you may want to brush up on the following areas. And yet this is a street smart paramedic. But this is a person who doesn't focus very well. This is a person that reads things too quickly. This is a person who thinks that just a brief run through, I've got it. As doctors, if we ever did that to patients, I looked at you once and say, oh, I think this is what's going on, and send you home. A handful of you in a 30-year career are going to come back either really sick, or you're going to come back dead. Look at the question the same way you're going to look at a patient. You have immediate, you have primary, you have secondary surveys. You're given 3 chances to look over a patient, correct their ABCs right away. The brief trauma assessment, then you go primary, then you go secondary. Well, if you're doing that, why aren't you doing that for your damn test? Why aren't you rereading the question? Make sure you reread it if you've got one of those stumps or you have to eliminate answers. Rereading the question, the number one most correctable characteristic that you can undertake as a person when you take an exam. I am a rereader. I reread the questions. Then I'll come up with the answers. You'll be in great shape. Again, and I have to reiterate this one, and I'm glad it popped back up again. All 4 answers, I may give you all 4 answers on a question that may be correct in their own right. Well, yeah, A, that's true. Yeah, that's right. That's true. C, you know what? Under certain circumstances, that's right too. And then D, oh, hell yes, that's right. Go back and read the question. Figure out, okay, I know all of these, which were really kind of crawls under your skin, but it's just like, you know what, guys, can you give me a clearer choice of answers here that would tell me what you're looking for, kind of thing? All 4 of these are correct. Which one am I supposed to pick? They're all correct. I don't know which one to choose. Go back and reread the question. Figure out, what are they trying to ask in the question? Yeah, it has to do with trauma. It has to do with the left side of the body. It has to do with the back. It has to do with a shock question or an EMS operations question. Which one of those questions in their own right answers the stem, in other words, the question. Okay, so you come up to that one question. It's written in Norwegian. It's written in Chinese. It's written by a 4-legged animal. It's not written by a human being. I look at the question and go, oh my God, what are they asking here? And then you look at the 4 answers and you go, oh my God, I don't even know what, I can't even guess. Statistically, if you're that clueless on a question and you have no inkling whatsoever what they're asking, the choice is either B or C. Now, number one, that's probably one of those test questions that they're trying them out, what they call a pilot question. They throw it into the mix after it's been in small groups. Now they throw it into the large national registry. Doesn't count towards your right or wrong answers. Doesn't figure into your scores, but you don't know which one of these questions is. So statistically, B or C tends to be the answer. Most of the time, it's B. If it's that difficult, run with B. If you got some inkling, go back into the other strategies you talked about. Elimination. Is it a range? Is it an echo? Is it like that kind of thing? But if you're completely clueless, I just run with B. But you have to stay that way through the entire test. Don't go, well, I think, let's see, I'm clueless, so today will be B, tomorrow will be C, this question will be C. Stick with it. Stay B. Okay, again, read the questions before you glance over the answers. There are some people that actually read the questions, look at the answers, reread the question, then answer it in their head. I'm looking for this answer, and then going back to the answers and finding out, is the answer there that I'm looking for? Some people take tests that way. I'm not one of them. I like to see the choices in front of me. However, that's not a bad strategy either. You read the whole scenario through and you go, you know what? This guy's hypotensive because he's got a knife stuck up his left side of the abdomen, and he's hypotensive tachycardic. I'm thinking this guy got the tail of the pancreas, the spleen, up through the diaphragm, got the lung. Then I go down to the answers and go, there it is. There's spleen. It's right there. And it makes it a little bit easier. Okay, so, all right, you're going to be faced with the last type of National Registry exam question, which is the negative or the incorrect answer. The incorrect answer is correct. In other words, which of the following is not? But you have to be alert to something here. As you're reading the computer screen, you're going to see the word not capitalized or perhaps bold printed. But for the most part, capitalized. We're calling attention as National Registry exam writers. I'm calling the attention to you to say, I want you to be particularly wary of this question because I'm not looking for the right answer. I'm looking for the wrong answer, which will be the correct answer, which is not a sign of labored breathing. This is an actual question from an old exam. This one's been floating around in the public domain for a while. But what's not a sign of labored breathing? Use of accessory muscles, that is labored breathing. An infant with a respiratory rate of 12, that kid's in trouble. Okay, we're losing them. Diminished breath sounds, yes. An adult with a respiratory rate of 12 breaths per minute, 10 to 12 is normal for an adult. 10 to 20 is normal. 12 to 20 is normal, anywhere in that range. But 12 breaths per minute in an adult sitting there easy, that's not a sign of labored breathing. So watch the bold print, watch the capitalized word, especially the word not. Because as exam writers, again, we want you to be alert to the fact that you're going to have to go down there and find out which one of these is a normal answer, which in this scenario would be the incorrect answer, so-called double negative. Okay, you got two correct answers. Which one are you going to choose that's best? You come across a scene. This is another exam that's in the bank currently. You may or may not get it. But you come across a scene where a patient appears to be in respiratory distress and is making gurgling noises. You immediately know that you need to intubate the patient? Hell yes. Perform chest thrust? No. Suction the patient? Yes. Log roll the patient? No. I didn't tell you that the patient was laying down front. I would have told you that, which would include you in on the log roll. So you're making gurgling noises. Why do we put in there? Some of you are way ahead of me right now. You're saying to yourself, gurgling, that means that they're choking on their vomit. They're trying to breathe through their vomit. They're breathing through secretions, such like that. Gurgling noises gives this one away. Yes, I will intubate the patient. Respiratory distress, gurgling noises, sure. I'll support their airway. But I'm asking you for gurgling. And gurgling clues you into one thing, secretions. Suction the patient first. Although A and C are correct, you're going to have to figure out which one of those answers fits the magic words that are in the question. I don't use the word gurgling much in my regular vocabulary unless I'm describing a patient who's in or who's choking on something. Okay. Okay, which of the following is not a true statement? We're back to a not. Again, you're looking at the question, you're going, what's frame up to? He wrote this question and he put a big old capitalized word not, or he bold printed it. Which one is not answer? Which one is not the correct answer? So you look through them and you go true, 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 false, true, false, true, true, or true, true, false, true. You're going to put a little T or a little F on your scratch paper to say, A looks like a good answer. It's a better choice for a patient having seizures. Conscious patients likely to experience gag reflex with the use of an oropharyngeal airway. That's true. If I'm conscious and you drop an OP on me, I'm going to probably say something, either tell you to get it out or I'm going to gag and throw up on you. Your oropharyngeal airway should be selected for an unconscious patient. Is that a true statement? Yes. You want to keep the tongue from falling back into the throat, including the airway. Pharyngeal airway is less likely to stimulate a gag reflex. Absolutely. If a person is semi-conscious, that's so-called semi-whatever, lethargic person, I'm not going to stick an oral airway in him. Hell, I don't want him to throw up on me. Now I got a bigger airway issue. So I'll drop an MPA on him. I'll drop a nasopharyngeal airway where I won't be stimulating their gag reflex. So now I'm back up to the top. The oral pharyngeal airway is a better choice for a patient having seizures. Well, as you can see with my explanation down below, good luck. A generalized tonic-clonic seizure, a person who's in status, who has got his arms stretched out and his teeth are clenched down. If you try to force an OPA into this person, you're going to break teeth. And if by chance they open their mouth for just a second, you slide the OPA in there and you get your finger caught, you lose a finger. They will bite down. And even somebody who's 8 or 10 years old can bite down. Socking them in the head to get them to release or yelling at them isn't going to do anything except aggravate the hell out of the parents. And if you got a seizing person who's suffering from alcoholism or a seizure patient who just has seizures, or the traumatic brain injury patient out there, these are tough calls. So seizures, for the most part, would contraindicate an OPA. So again, when I formulated this question, when the other medical directors formulated it, which one is not a true statement? What's the question really asking? Which one is false? But we like the double negatives because we want you to look at all the questions and then all the answers. And you tell me. Okay. The lub sound, lub dub, S1, S2, lub dub, lub dub. Which one's a lub? So you got opposites here. Okay, the atrioventricular valves are opening or closing. Pulmonary valves are opening or closing. I made this a double-double here because one set of these valves don't necessarily make a whole lot of noise when they close because they're on the low pressure side of the heart. So that should give you a clue. So as you get into this question, you go, okay, I know it's the closing of somebody, but I don't know who exactly is closing, but I know the pulmonary valves don't make noise, so it's got to be A or B. This is an example of an opposites. If the AV valves are opening, closing, you can disregard C and D right away because they don't make noise, okay, unless you got a super high-powered echocardiogram that pick up the pulmonic valves. But for the most part, the AV valves are the ones that make the lub dub. And so you have to ask yourself during the S1, are they opening or closing? This is an example of opposites. If I know only the AV valves make the noise, one's opening, one's closing, one of them has to be correct. And this is where you get into eliminations. Okay. All right, most correct answer. Now this is a scenario that we pulled from previous exams. I don't think it's in this scenario cycle, but this is from a previous exam. But take away from this what it's meant to be. You arrive on the scene with your partner to a slip and fall. The patient's 49-year-old who slipped and fell while jumping onto a dock, came up just a little bit short. After hitting the dock, he fell into the water where his friends pulled him out. He's conscious, complaining of only pain in his left shoulder. He's lying supine on the dock. He's shivering and holding his elbow. What's the proper course of action? What is the proper course of action here? All right, so I've got two reasons why you should choose one answer here. First and foremost is going to be safety of the patient, scene safety, spinal precautions, such like that. The second is going to be the longer, most complete answer. Let's see, I can put them on a backboard, I put them on a cervical spine, precautions, O2 and transport. So what am I thinking? He's shivering, he's complaining of pain in his left shoulder, he's holding his left elbow, presumably to make left shoulder. But when he jumped out, he was conscious, complaining of pain, but he's lying supine on the dock. In other words, he's not willing to move. He's not, something feel right about this. And when people jump onto docks from boats and they come up a little short, they either hit their shoulder, hit their upper body, or hit their chin, snap their head back. And so a shivering response may or may not be pertinent here. We don't know. The fact that the water presumably is a little colder than the atmosphere would certainly cause a shiver response. But in this particular case, we want to load them on a backboard, C-spine precautions, put them on oxygen and transport. Cut off wet clothing, high-O fluid, check PMS, high flow O2. Probably not in a hurry to do that. If they're on a boat, on a dock and such like that, if it's cold outside, you may be causing bigger problems. You can cut their clothes off in the back of a nice hot ambulance if it's a cold day. Certainly, if it's a typical boating Labor Day kind of stuff, it probably wouldn't be pertinent. Again, we're not trying to read too much into it except to say that we've got C-spine precautions here. And it's really the only one here that's giving you any kind of scene safety, patient safety kind of issue, BSI kind of issues, such like that. What's going to protect the patient? Now, if this was a similar scenario where the patient's unconscious, lying supine on a wet dock after they've pulled him out and he's got wet clothes, you get to his side, you put the AED on him, and you defibrillate him. Again, that would be probably a party foul. And it's not something that you want to do while kneeling in the same water that the patient is also wet in, and that AED delivers a monophasic shock of greater than 200 volts. It could light up you and your partner both. But the question didn't ask that. But if the question does ask that, make sure that you remove the patient from that particular area by whatever safe means that you can, even if it's an emergency move. Make it a quick move to get out of the water so you and your partner are safe. So that would be a variation on this scenario here. Okay, and then you got degrees of severity. So read the question again carefully and decide: partial airway obstruction, hyperventilation syndrome, mild airway, severe. So I got a mild, partial, and severe. They mixed up the order a little bit. Patient shows signs and symptoms of inability to speak, weak or no cough, grayish face, bluish lips. What does that tell you right away? He can't talk. Right away, what should that tell you? And then he can't even gag, he can't even cough. And his face and his lips are turning gray and blue. It pretty much sums up exactly the philosophy of the National Registry. We're not here to trick you when we create these questions. What we want to do is give you as much information as possible to make sure that it can never be disputed what the answer is. So if you call them up and say, I didn't like your question 11, they're going to say, yeah, well, too bad. You probably didn't like a lot of questions on there because you didn't understand that we're not here to trick you. We gave you so much information. How could you come up with any other answer but severe airway obstruction here? He can't talk. He's weak. He can't even cough. His lips are blue. What does that tell you? And there you go with the degrees of severity question. In other words, you'll see the same thing with hypothermia. And no, by the way, for the cycle coming up, hypothermia, know the degrees for the mild, moderate, and severe hypothermia. Get that memorized down. And we'll go into brain dump here in a second. And then anaphylaxis is always a favorite. It appears on every cycle of every exam. What is mild allergic reaction, moderate allergic reaction, severe allergic reaction, anaphylaxis? Those are the progression. When you go from severe allergic reaction to anaphylaxis, you're in a heap of trouble because anaphylaxis really is shock. And so if your patient has normal vital signs and is having some wheezing after being stung by a bee, but he's able to talk to you, you're looking at moderate. Mild allergic reactions usually is a skin manifestation. And these are just clues that I'm giving you for the exam. If you're dealing with any kind of insect or venomous sting, from an arachnid or from an insect and such, not including venomous snakes. But when you get these kind of bites or stings and the patient starts showing signs, if they're broke out completely in hives, but they're talking normal, vital signs are stable and such, it's a mild reaction. It may look bad because it's all over their body, but it's a mild reaction. You start getting into moderate when you start getting breathing difficulties. Severe, you start dropping your pulse ox and you're really struggling. Of course, when you start dropping your blood pressure and altered mental status, you start getting an anaphylaxis. Make sure you know the degrees of severity for hypothermia, anaphylaxis, and this one, airway obstruction. Okay, brain dump. That's the last slide, and then we're going to wrap this up. So brain dump is just that. You decide, okay, I'm right at the end of this whole thing. 2 days before, I'm going to write out on a piece of paper things that I just need to memorize. And so you write on that piece of paper breathing rates and degrees of obstruction. And you may want to memorize a couple charts or graphs, whatever you feel that you're not completely comfortable with, and you're just going to have to say, look, I have no understanding of this. I'm just going to have to memorize it. So 2 days before you start your memorization, and then you write it out 5 times. 6 is the magic number. 6 times memory improves dramatically. So you write out a full page of stuff, 6, and you do it 6 times. Now you've got it memorized. Of course, the day before the exam, you're just going to rest and relax, exercise, work out, play tennis, play golf, whatever you're going to do. And then the day of the exam, you're going to be at person view. They're going to check you into the exam, just like you do with your EMT. You're going to sit down in front of the computer after they're done with their strip search and all the other, making sure you don't have cameras, in your collars and such, and they frisk you. You're going to sit down. They're going to give you the piece of paper, the scratch piece of paper. At that time, they're going to say, okay, you may begin. You're going to do the brain dump. This is when you take everything that you have memorized on that sheet of paper, and you're going to transfer it now out of your memory onto that piece of paper. Once you have brain dumped, then you can sit back, then jump on the computer and start your test. You're allowed to sit there for as long as you want before you start the test. When she says start, you can start your exam. Just go ahead and sign in. A timer will start, and that'll be the start of your 2.5 hours. So don't start it until you're done with the brain dump. Memorize things that you don't understand in the class. Decide what's sympathetic and parasympathetic. You don't have to know dosages for the exam. You do have to know 1 or 2 parametric calculations for the exam. If you're good at it, memorize the formula and make that part of your brain dump. But before you start the exam, but after you're sitting down, because they only allow you the scratch paper, do your brain dump. This has been successful for a lot of folks, including myself in medical school. Was you'd write out a whole page of stuff, flip the page, and write out the next whole page of stuff. And you do this 6 times before the exam. And then at the exam, they give you a scratch piece of paper. You write it all out. Then you start your exam. Okay, so that's the so-called brain dump. Now, they will confiscate that after the exam. Say, okay, this is the piece of paper that you used. Yes, put your name at the top. Okay, I did. And then that goes in with the exam and it's stored forever. Look, if you pass the exam, nobody pulls your exam. We don't care what's on the scratch paper. That's for your use. All right, in summary, read the last line of the question and all 4 answers. Read the entire test item. Please take your time. Please take your time. Those are the best 2 advices that I give you. And then no drinking or anything else before the exam that night. Get a good night's sleep and show up at the exam. If the exam is out of town, go there the night before, sleep in a hotel so that you're on time, that you're not putting 2 hours of driving and all the frustrating traffic before you even get there and decide, oh boy, that was a frustrating drive. I can't wait to get home. rush hour starts at 4. I'm starting this damn exam at 2. Man, if I'm not out of here by 4, I'm going to be in traffic for 4 hours. Those are all bad. That's bad. You're already starting, with the mindset that's out in left field right now. Take your time, do it correctly. It's best that you do this correctly this time. For some reason, everybody finds more time to do it correctly the second time, when had they done that the first time, they wouldn't have to go through it a second time. I don't know what that's all about. We all do it. It's human nature. Do yourself a favor. Do it right the first time. And again, get a good night's sleep. All right, I'm going to back out of this and hope it lets me. This will be a course recorded. It'll be put on site so that y'all can take a look at it. And okay, we picked up a couple of you guys along the way. Let me get to the chat screen here, if I can find it. Okay. Anybody have any questions for me before we wrap this up?
Waiting to see if there's an echo in here. Oh, there's one from, oh, no question. Jason's good. Aaron's good.
Okay.
Noreen? Pamela? Eric? Oh, okay. Jason has one for you on a personal level, and Eric's got a question for you there.
All right. How close you normally need to get with drug doses on a test, rounding wise? We create the test so that when you do your calculation, it comes out to a round number. And you should be able to do the question with minimal calculation. If you've come up with something that's weird, like pi 3.1417, blah, 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 you got some big, long, weird answer, it's probably not right. We use 100 kilogram people, and that's your clue that you're at 0.1 per kilo. We use 70 kilogram people for the 0.1s or the 0.2 milligrams per kilos. And then, of course, when we use children, we're going to give you the age of the child, but we don't expect you to memorize the Braslow tape. What we'll do is we'll give you a range. In other words, epinephrine is 0.01 milligram per kilo. Atropine is 0.002 milligrams per kilo. And those are going to be part of your brain dump. Those are going to be a 2 that we ask you about infants and newborns. But the rest of it are going to be round numbers. So it is rounded. So if you can eyeball a question, and mathematically you're pretty good with this stuff, where it looks like, yeah, this is going to be more likely the answer here, that is going to be more likely the answer. Again, not there to trick you. We just want to know, can you think on your feet and do some of these calculations? Now, here's the big secret with the National Registry. Each one of these calculations can be done in your head. However, we understand some people's math is not that strong. So they will need to do the calculations on the paper, but each of these calculations can be done on average within 15 seconds. So don't be looking for anything super hard here. Okay, now hopefully that answered Eric's question. And Jason, you said you had one on a personal level.
I'm going to throw something out there real quick for Eric before you answer Jason. Eric, he is talking National Registry, not our pharmacology qualifying exam, just so that you understand. National Registry's goal is to establish that you have minimum competencies with pretty, finite information to make sure that you meet a minimum standard. When we give you the pharmacology qualifying exam in our course, we're testing you a little bit more intensely because we're trying to make sure that you can do more complicated calculations in the field and can do the mathematics required for some of the stuff that you may have to see, especially in doing patient care transfers, working on a helicopter, working on a fixed wing, working in the ER, in more challenging settings than just an entry-level paramedic would have to do. So I wanted to make sure you understood that if you haven't taken your pharmacology qualifying exam yet.
Yeah, the PERCOM pharmacology qualifying exam follows the National Registry standards. And so you have to do all of those calculations. Jane's exactly right. But to speak directly to the question, is there rounding allowed and such like that? The answer is yes, but you'll find that you won't have to round it. It's all pretty straightforward. Hell, a 100-kilogram person given vecuronium at 0.1 is going to be 10 milligrams. The answer to Jason, yes, I was deployed in 2016 from, I think we got there in May and then left in October 2016. Were you over there at the time, Jason? Kabul. Okay. Oh, okay. Yeah, we flew a couple of K5 runs down there. I was in Bagram and flew with the C-130 squadron, which was doing the patient evacs, as well as some of the runs out of Kandahar and Kabul. We were there as well, and then up at Moza Sharif and some of the other weird places around the country. But yeah, I was there. You stay safe there in Kabul. I heard it heated up a little bit here just recently. You guys still taking missile hits down there? Or are they hitting the base at all, or is it all out on the general populace there? Yeah, fair enough. I don't know if they can hit anything intentionally, but every once in a while they get lucky. All right, guys. Well, it was great having all of yous. And my email address is in my bio, but if you got a piece of paper, jeframe@comcast.net is my easiest one to get a hold of me. It comes right to my iPhone, obviously. And if you have any questions or comments, please don't hesitate. I'm happy to answer them. If you go over this video again a second time and there's something that you still don't understand, I'd love to hear from you because that'll help me shape the future lectures for test taking strategies. All right, well, everybody have a great night. No, you're right. It was nothing like Iraq. They nailed us pretty good in Iraq. So anyway, you and I could talk all day, Jason, but you stay safe over there, and we'll look forward to your return.
Thanks for coming, everybody. Good night.